Liposuction. Liposuction process. Liposuction aims to remove excess fat in certain areas of the body in order to improve the body's aesthetic appearance. Many people also resort to liposuction after the failure of other means to reduce weight. Contrary to what some believe, liposuction does not treat cellulite or obese. The procedure depends on the use of a device that works on suctioning small parts of the excess fat tissue accumulated by a vacuum pump. And it is important to know that this process cannot be performed in all areas of the body. And it is usually performed in the abdomen, hips, flanks, and buttocks, arms, and areas under the chin. Risks of performing the operation. Liposuction procedure is associated with many risks, such as the following: infection in the surgical incision, bleeding in the area, scars at the incision site, a drop in blood pressure, fat embolism, damage to the nerves near the suction area. Before the operation, a pre-meeting is conducted in which to know if the patient suffers from other diseases that prevent him from performing liposuction, and to discuss the reasons that made them resort to this type of operation. After that, the doctor informs the patient of the areas from which liposuction can be performed. According to his condition, the patient needs to perform some tests, such as a complete blood count, blood chemistry, and coagulation tests, and if the patient is elderly, he is asked to do a chest X-ray and an electrocardiogram. The doctor should be consulted about the medications that the patient should stop before the operation, and alcohol should be avoided 48 hours before the operation. In addition to the need to fast for 8 hours before the surgery. During operation, the process is done as follows. The doctor draws lines with an ink pen on the patient's body to define the areas chosen for liposuction. The patient is subjected to local anesthesia, and then to the cleansing of the skin. A small incision is made and a suction needle is inserted, which is connected to a clear, hollow tube. Liposuction begins with the necessity of avoiding suctioning more than 2 to 5 liters of fat. Because of the high risks that may affect the tissues, a small bandage is placed over the incision area, and the liposuction process takes about 1 to 3 hours, depending on the amount of fat to be removed. After the operation, the patient must stay for 1 night in the hospital to ensure that his health condition is stable, and the support belt or compression pants must be worn for 3 to 6 weeks in order to reduce swelling. Many bruises may appear that last for a few weeks before fading away. In addition, pain relievers can be taken if the patient feels pain after liposuction. The patient must call the doctor immediately if some symptoms appear, such as feeling severe pain, loss of sensation, feeling weak, high temperature, shortness of breath, secretions from the surgical incision, and bleeding.